Alright, doing a walkthrough over at this home here, starting at the stairs. Got some contamination here, base of the stairs, couple up, going up the stairs. Couple drips, there's a spot up there. As we walk through, here's the litter box. See some over here, a couple big ones. I've done a moisture meter check, moisture probe check, and some of these beep. I'd say about half of them beep, which means that we suspect it's probably into the pad. Big one there. This corner was hit pretty well. There's actually some up on the wall right there that's been splattered down. A little bit on this wall. This corner was beeping profusely. This corner was beeping profusely. It's up on the baseboard a little bit. This might have been some up on the wall that dripped down this wall. It's over by the ping pong table. Spot there. This one did detect with the moisture meter. The moisture meter works by a simple shorting of the two prongs. So when we poke it down into the carpeting, if it beeps on the top of the carpeting, that means that there's urine towards the top. If the further down we push, then the faster it beeps. That means it's probably in the pad. So it's a quick and easy way for us to find out approximately how deep the contamination has gone. Generally, on a small cat or dog, if they've only done it a couple of times, a couple of spots, it will not beep because the urine salts have not had a chance to dry together and cause the prongs to short, which would make it beep. In this case, there's been several areas where the pet has gone over and over, which will collect, and the urine salts will dry together, thus causing the moisture probe to give us an audio beep telling us that it's shorting out, meaning that there's urine in the pad. Overall, I'd say probably 15-20% of the carpet has had some sort of urine contamination or another. Cleaning it by itself from the top side will certainly help. However, if it is into the pad in certain areas, those areas would have to be addressed. So we would end up having to either pull the pad out and replace those areas, or flood it from the top side with the decontaminant and use a subsurface extraction tool to pull that moisture back out. That it's in a basement is helpful because we can actually flood the area with decontaminant. If it was on the first level or second level over a basement or a first level, then we couldn't be as aggressive with flooding because it could cause damage to the below surfaces. Okay, that's it for this room. Some more over there. And there. And let's go to this room here. This is a very powerful blacklight. You do not want to look at it directly or shine it in the face of anybody. So if I see a pet walking by, I'm not getting it anywhere near them. not good for their eyes. And this room, when you first walk in, has a detectable urine odor that gets less pronounced the further you walk in. This corner is pretty, I can smell it in this corner pretty badly. There's some more. The success of this one, I'd say if we did a topside cleaning, would probably improve it about 50%, maybe a little bit more. So you'd have about half the odor that you have right now, which would leave just the odor into the pad. So it's a tricky one. The issue is that a lot of these, some of these are around the corner, so that's not too bad. But some of the urine is actually out in the center. So dealing with out in the center, urine that's out in the center is not an easy task, because we can't pull the carpet back and just treat it. Let me try to pull these doors open. They don't have any handles on them. Okay, well, the cat just rushed in here, sniffing around. Come on, let's go. I guess it wants to play or hide, so I will come back and get the cat in a second. Alright, so I've done an inspection in both these areas. I just want to quickly kind of rush or flood the area. See if I've missed anything. It looks like I did a pretty decent job of finding it. So yeah, going back to what I was just explaining, when we do a topside cleaning, we're able to get that contamination that goes down to the top of the carpeting, but not necessarily into the pad. And the way to get rid of that is by flooding with the decontaminant and then extracting that out, or replacing the pad if it's near a wall. Seeing that a lot of these are out in the center, these contamination marks are out in the center of the room, pulling the carpet back to this point is not feasible. If you do that, you have to restretch the room, restretch the carpet back onto the over top of the new pad that has been replaced. So then it comes down to this is a new buyer. It comes down to the question, does the customer want to negotiate price? Is this something that they should negotiate price with and then just replace it? And our cutoff, our general rule is if it's 25% or more affected, especially into the pad, at that point it may be a better idea to get it replaced than to try to get it repaired. And this one is probably near the, if you took all the spots and put them together, maybe the 15-20% mark. So we're right on that cusp. Right on the cusp of recommending probably should get replaced, especially since they are very sensitive to odors, the new buyers. And I always go back to what would I do if this was my house? What would I recommend? And what would I do personally if I was purchasing a home? Me personally, it would definitely be part of the negotiation.